Hello everyone, this is Dr. Nikita here back with another mnemonic of the day, and very important today is branches of the internal iliac artery. So internal iliac artery has an anterior division and a posterior division. What are the branches? Let's have a look at that. The question here is all are branches of internal iliac artery except superior rectal, superior vesical, middle rectal or inferior vesical. So as we said, the internal iliac artery has anterior and posterior division. So the trick to remember is remember the branches, the anterior division branches, it is mousy. Instead of mouse, we write it as mousy, that is with triple I. So imagine this is the ant, okay, that is the anterior division, and this is the mouse. So this visual will help you remember anterior division ka mnemonic is mousy with the triple I. And for the posterior, P for P, it is pills. Posterior is pills is the mnemonic that we have to remember. Now, what does mousy stand for? Another thing to remember here in anterior division, it supplies the organs here in the pelvis. So we have urinary bladder, we have uterus, and we have rectum. So the arteries to this urinary bladder artery would be vesical artery. So superior and inferior vesical artery both. Uterine artery is what will come here. Rectal artery, which one? Superior, middle or inferior? It is the middle rectal artery. So when we say mousy, it is middle rectal artery, it is obturator artery, uterine artery, superior inferior vesical artery, inferior gluteal artery, and internal pudendal artery. So remember this S and I is superior and inferior vesical artery. In the females, what gives the vaginal artery is your inferior vesical artery. So this inferior vesicle, let's imagine the inferior vesicle, at the inferior vesicle level, we have the vagina. Remember, vaginal artery is the inferior vesical artery in females. So mousy is this. Now coming to the posterior division. Posterior division, it is pills. Now if we start from above, we have the lumbar, then we have the sacrum, and then we have, imagine that there is the gluteal region. So iliolumbar artery, lateral sacral artery, and the superior gluteal artery. Okay, it's the superior gluteal, not the inferior gluteal. So let's have a look at this image here. This is where we have the posterior division of the internal iliac artery. This is the aorta. We have common iliac, that is giving the external iliac and the internal iliac. Internal iliac posterior division, we see the iliolumbar, I, posterior pills, posterior ILS, iliolumbar, then we have the lateral sacral, and we have the superior gluteal. You can see this muscle here, which gets the name superior and inferior gluteal. That muscle is the piriformis, another important question. So superior gluteal artery. So ILS, that is pills. Rest are the branches of the anterior division. So what is the anterior division mousy? It is middle rectal artery. That is what we have. O is the obturator artery, uterine artery, superior vesicle, inferior gluteal, and the internal pudendal. Superior vesical artery is basically a patent part of the umbilical artery, which the obliterated part forms the medial umbilical ligament. The patent part forms the superior vesical artery. And we said that inferior vesical artery is what gives the vaginal artery, is the vaginal artery in females, right? Looking at another image here again, what do we see here? So we have the common iliac artery that has the external iliac branch and the internal iliac. Internal iliac, the three branches. Posterior is pills. Remember, it is pills, iliolumbar, lateral sacral, and superior gluteal. So iliolumbar, lateral sacral, and superior gluteal from posterior. Remember, superior gluteal, superior has P in it, so it is from the posterior division. Inferior gluteal does not have P in it. It is not from posterior. It is from anterior. Ant is mousy. So we have the middle rectal artery. We have the obturator artery, O. We have the uterine artery, U, MOUS. Superior vesical artery. Inferior vesical artery, that is the vaginal artery in females. Then we have the rest of the eyes, internal pudendal, and the inferior gluteal. Right, these are the branches of the internal iliac artery. Going back to the question, all are branches of internal iliac artery except, so superior rectal artery is not a branch. Middle rectal artery is a branch. Superior inferior vesicle is a branch. Superior rectal artery, if this is the rectum, we have the intestine. So what gives the superior rectal is the inferior mesenteric artery. Okay, it's a branch of inferior mesenteric artery, superior rectal artery, right? Remember the M is the middle rectal. We have superior rectal, middle rectal and inferior rectal. Superior is from IMA, middle is from the anterior division of internal iliac, inferior is from internal pudendal. The answer here is superior rectal artery. Another review question for you. Do let me know in the comments what is the answer. All are branches of internal iliac artery except what is the answer and what is it a branch of? Do let me know. So I hope you remember the mnemonic mouse, that is anterior ant and mouse, the two animals going together, and posterior is pills. This is your superior gluteal artery. So that was a quick trick on branches of internal iliac artery. I hope this simplifies this topic for you. Do let me know in the comments your feedback, which is very valuable to us. And thank you so much for watching then. Goodbye, take care, and keep studying, keep revising, and keep winning. Thank you so much.